I'm Julie Grutzmacher, the Director of National Collaboration and Engagement at Prevent Blindness.
Hi, my name is Shervonne Poleon, and I'm currently a graduate student at the University of Alabama at Birmingham.
Shervonne, I understand that you're a researcher. How did you become interested in research, and what do you enjoy about it?
So, I have always been interested in research. I'm a very curious person naturally. And so I always try to figure out the answer for a question. Why is the sky blue? Why do persons behave in a certain way? And by persons, I mean myself. And so I've always been very driven to solve problems and find creative solutions to problems. And I think that is the biggest reason that I decided to go into research. And I think that the best part of research, or rather my favorite part, of research is really the ability to apply whatever it is that I learn. So I get to learn something in the lab, I get to learn something by going through literature and journals, I get to learn something by collecting data. But on the back end, I also get to apply that, whether that's in my life directly or whether that's to help other individuals through the development of programs or interventions. And so research has always been a very fun exercise for me. It's not very structured in that it looks different every day. Today, I might be collecting questionnaire data from participants and working closely with participants. Tomorrow, I might be analyzing data. The next day, I may be writing. The day after that, I may be presenting. And so it's a collection of different skill sets, and you learn so much in many different areas. And it's very fulfilling to me actually. And so I do enjoy research, but the biggest part for me again is always just being able to apply the lessons, the values, and the insight that I've been able to glean through my research. That's the best part for me always.
And I'm curious if there's a story that comes to mind when it comes to being able to apply what you've learned in the lab to with with patients. Is there something that comes to mind for you?
Well, so the my research area is really glaucoma and medication adherence in glaucoma. So in glaucoma, there are a lot of challenges that get in the way of patients' ability to instill their eye drops every day. And that is a very interesting disease model to study because while I don't have glaucoma, I know all about challenges to doing something that I need to do. And so the biggest application of my research is really in the lives of myself and my loved ones. As I mentioned, I don't have glaucoma, but I'm a human, and I know what it means to have to do one thing and to find it difficult. For example, I love running, but I haven't run in 2 weeks, not because I can't, but because I don't want to, or I may have other things that take up my time. And so in my own life, I get to experience the push and pull between doing something that I know will benefit me health wise and all the other things in my life that pull me in different directions. And so in my research, I am the model. I am the person whose behavior I'm trying to change. I'm developing those interventions for other persons, yes, but also for me because I'm guilty of having medications sit on my bureau and expire without me using it. I am guilty of instilling my dry eye drops once a week instead of twice a day, like the doctor says. And so everything that I learned in my research, I try to put it in the context of my own life and think, Shervonne, why don't you do this? Or Shervonne, why don't you use your medication? Is it only because you're busy? Or are there other things below the surface? Maybe you're anxious about it. Maybe you don't want to get too involved because you're not really convinced that you need to take it. And so I try to draw all of those experiences, my own self-doubt, my own experiences. I try to draw that into my research because ultimately, This is research that's intended to reach real people like myself. Um, and that first other question that you asked about application, um, I have other applications for my research. Some of them are pretty trivial, but one of the things that I've learned in my program, one of the things that we're encouraged to do is share our research to persons who are not researchers. So simply explaining what it is you do in 5 seconds or less, like an elevator pitch. And that has been very, very helpful to me, of all places, on Facebook. Because, and it might seem really, really strange, but right now we're in a space where communication is not as streamlined as it should be. We don't really listen to each other in the way that we should. Many of us, we listen to respond versus listen to learn. And day in and day out, my own program and my research forces me to listen to people and communicate with them, listen to patients and hear what they're saying. Listen even more deeply than what they're saying, to try to figure out what are the factors behind the scenes that influence behavior. And that listening air and those communication skills that I've learned through my research and through interactions with other people, I've been able to put those into good use, of all places, on Facebook and on social media, just getting my point across, um, knowing how to be empathetic, knowing how to not be combative, knowing how to be sympathetic to the plight of someone else. And that's just one other thing that I think is very beautiful about research and some of the lessons that you learn. It's not always about being in the lab. Sometimes you learn so much just from talking to other people, and you pick up additional skills. And you would be surprised where those skills come in handy, whether it's your day-to-day interactions with other people, or maybe just writing, project management, etc. And so the biggest thing that I've learned from my research is just interpersonal skills, being able to talk to people, being able to exchange with people, being sincere in interactions with people. And that's something that you really can't learn from reading a book or writing. You really do learn it from getting in there, meeting people, getting your hands dirty or clean, and just interacting with patients, clinicians, other researchers, et cetera, et cetera. You really learn quite a lot just about humans, and how to interact with humans. And I think that's one of my more transferable skills, from my research, my patient-based research. So I know I said a lot there, but definitely do research. It'll help you out on Facebook and social media.
That
As well as just day-to-day interactions with your loved ones, and you know your friends and your acquaintances.
mhm, mhm. Yeah, and I feel like you hit on so many important points, and some of them are kind of contrary to I think public perception of research. Um, and you alluded to some of the advice that you might give fellow researchers. But I'm curious, what advice would you give to somebody who is considering a career in research?
Okay. What advice would I give to someone who is considering getting into research? So the very first thing I would say is, research. Do some research on what you want to get into, because research is very different, for many people. If you want to go into more patient-based research or clinical research, that might mean a lot of interactions with patients, a lot of interactions with providers. And if that's definitely something that you want to do, then you can pursue that as your career. If you're more interested in maybe lab work or biomechanical mechanisms of vision, you may not be required to interact as much with patients or clinicians. You might spend more of your time in the lab. And so the most important thing is, figure out what you want to do and what a career in research would look like for you down the line, because that's very, very important to come in with the right set of expectations. Currently in my program, there are a little over 30 of us, and everyone does something that is completely different. Everyone has a different research experience. And so your research experience is tied very closely to the problem or the topic that you're looking into. And so the first thing I would advise anyone to do is research that research area and then find out what that would look like. Maybe you would have to spend more time in a clinical setting. Maybe you might have to spend more time in a laboratory setting. So that's the first thing that I would say to anyone. The second, I think, biggest piece of advice is make sure your heart's in it. Make sure your heart is totally in it because it matters a lot. Research is not always easy. In fact, it's kind of like there's a giant pile of things in front of you and you have to sort it and make sense out of it. And so sometimes it will be rewarding while you're making sense out of it and the light bulb goes off. But in the beginning, when you're trying to find your way, there might be a few snags. You might experience some difficulty just navigating the field and figuring out how you need to structure your research and having your heart in it, as well as having a fair amount of discipline will really make all the difference during those long nights, during those weeks, those 80-hour weeks, 90-hour weeks. So make sure that it is something that's very personal to you or something that you're truly passionate about, because that's really the fuel that's going to keep you going. Because research is not always it's not always talks and presentations. Before you get to the level where you give a talk or a presentation, there's a lot of work. There's a lot of work that goes into it. So make sure that it is something that you're truly interested in or passionate about. And then the last bit I would say is have fun with it. Research is about continual learning. When I first came to UAB, I assumed that all of my advisors knew everything and I was here to just soak up information from them. But in fact, going into research, it's a state of continual learning. You never stop learning. And one of the biggest things that you will get out of a career in research is humility. It kind of doesn't seem that way these days, but you do. You have an opportunity to make mistakes, learn from those mistakes in a safe environment. If you make a mistake or you don't know something, no one will judge you or throw you out. It's a very welcoming space where everyone who's involved in research, the goal is to learn more. And you can't learn if you don't make mistakes. You can't learn if you don't ask. You can't learn if you don't fall flat occasionally. And so if you're thinking about getting into research, definitely consider that you will be learning throughout your life. You don't necessarily just come in and leave with a set of skills in between entering or in between, the moment when you first start to the moment that you end your career in research. You are learning continually, not just technical material, but as I mentioned earlier on, you're picking up so many amazing skills that you could apply in other areas of your life, whether it's baking a cake or arguing with people on the internet or helping a friend or a loved one navigate the clinical system. Research is just a very interesting and a very rewarding field. And one of the greatest things about it is that it's dynamic. You never do the same thing every day. You're not going to be bored because you're sitting in one spot doing the same thing. It's very dynamic. It's a great learning experience. You'll be learning throughout your entire life, and you will be sharing that knowledge and that wisdom with other people throughout your entire life. And so if anyone is interested in a career in research, absolutely get into it. It looks different for everyone, and it's very malleable to your own ambitions. So it's not something where you come in and it has to be X, Y, Z, a rote set of steps. You largely influence the course of your career as a researcher. So you have that independence, you have that autonomy, and there's not that many areas in life where you get to be flexible, you get to have autonomy, you get to learn throughout the experience, throughout the entire experience. And it's just a really amazing career path. And so if anyone is interested or curious or just thinking about it, don't be dismayed by, if you think it's so much and you can't, just do some research and see, there might be something that is waiting for you specifically. And so totally get into it if you think you might be interested.
Thanks, Shervonne. And thinking about patients specifically, um, what is the value of patients getting involved in research? And do you have an example you can share, or a story maybe of a time when a patient getting involved in research, whether it be in a clinical trial or qualitative focus group, that it made a difference in the processes, or the outcome, essentially.
Okay. So, you know, this topic of patients being more involved in research, I think it's a conversation that needs to be had a lot more. And we have clinical research where patients would enroll and participate in those studies, but that's just one component of patients participating in research. And that's a great component in and of itself. So there are so many benefits of participating in clinical research. So as we know, certain conditions, there are not available treatments for those conditions. And so clinical studies provide an avenue for patients who are unable to get relief through other types of medicine to participate in clinical studies and perhaps get relief through the experimental treatments that are delivered in clinical research studies. But that's just for one particular group of patients, a small group of patients. The truth is that most patients who participate in clinical research do so because of altruism. They see the value, not necessarily for themselves, but for other patients. So, clinical studies that are maybe trying to deliver a new type of intervention to maybe improve management of glaucoma or to improve visual outcomes after cataract surgery. Those types of studies, clinical studies, the patients who participate in them, are also helping future patients who may have to experience that problem. And so, for current and future patients, that is a big uh, just a big bonus, a big advantage of participating in clinical research because as humans, most of us, have that part of us where we love to help other people, but like all of our lives are so busy and we don't always have the opportunity to help a stranger that we don't know. And participating in clinical research studies, that's one opportunity to help other participants and to help other patients. In fact, the I just had a patient a few moments ago, and that's exactly what we were doing. We're trying to develop programs to help glaucoma patients to become more adherent with their medication, so to use their eye drops more consistently. And what the participant was actually doing was giving their feedback on different types of programs that could or could not be implemented. And if you have that input from 20 or 30,000 patients, that goes a very long way because now you have a much better idea of how useful different types of treatments or different types of interventions would be. And so besides the personal benefit from taking part in clinical research, there is also that altruistic, benefit to other individuals who you may never meet, but you share a common bond with them because you're dealing with the same condition, you're treating the same condition. And at least in my experience, those are two of the main reasons why persons participate in clinical research, well, patients. But there are also other reasons. Right now, certain groups, certain demographic groups are underrepresented in clinical research. And improving that representation can really have tremendous benefits. For example, priority areas or problems in specific minority populations may never get the spotlight that they deserve, may never get addressed in the way that they need to be addressed because there's so little participation. And so something that should be a priority really is not a priority. And so, especially if you're a member of a minority population like myself, definitely participate in those research studies because what they can do is shine a light on your community and shine an even brighter light on specific priorities that should be addressed within your community. And as I mentioned with the other study that I just got through with, it also gives you an opportunity to shape policy and inform policy down the line. You never know if that one study that asked for your input is going to feed into another study, which is also going to feed into a policy that is created 5 or 10 years down the line to help other patients. And so there's the motivation of personal benefit, which is always great. And then there's the motivation of just helping out other people, or altruism, which is even greater. And then just being involved is kind of like a floodgate. It multiplies itself. So today, if my grandma decided that she wanted to participate in a clinical study, that when she comes home, she might talk about that study a little bit. She might get me, her granddaughter, interested in why she's going to the hospital 3 times a month. And me being interested could open up so many other floodgates. I now start to share information with her, ask her information about her study. She might ask me to look something up on the internet. And that might lead to me becoming more interested in clinical research and pursuing that as a career opportunity. So we never know what one thing can lead to, but definitely patient participation in clinical research can lead to so many other things. Improved just priority in one area, and improved visibility for a population, opportunities later down the line for others who were inspired, or they had that contact with clinical research through someone else, and they themselves became involved. And you don't always have to participate in a clinical study as a research participant. If you're a patient, you can volunteer. In fact, here at UAB, we have the Minority Health Disparities Research Center, and they work with persons in the community. Okay, so these individuals are not researchers; they're lay persons in the community who want to get involved in research in some capacity. So they might help with identifying persons who might be interested in a study. They might help to bring together different stakeholders. And so participating in a research as a patient does not always mean that you have to be a research participant. You can be a volunteer. You can be a part of community health organizations that work in tandem with research organizations. And so if you think that this is something you may be interested in, don't hold back. Definitely jump into it. And if you are thinking about it, I would say that there are so many benefits. And I know you kind of mentioned it, Julie, but right now we're having sort of a disconnect between the scientists are on this side talking and everybody else is on the other side, and there's kind of a gap between the two groups. And I mean, we're all patients to some degree, but this is one of the ways that we could help kind of close and bridge that gap between researchers and everybody else, because there's a lot of great research that takes place, and an excellent study might be published in a journal, and no one might read it. Maybe that patient with who's married to the billionaire sponsor, what if that person got their eyes on that study? What if that person got involved in that study? What about the incredibly gifted patient with the IQ of 160? What if that person got involved in a research study? That could lead to so many other opportunities and networks. And I think that that's one of the strongest ways that we could help to kind of close that gap that we have right now. Because all of us are patients. If X patient takes part in my glaucoma study, and I'm a patient, I participate in some other study in a totally different discipline, all these little contacts over time are helping to push the ball and move the field. So I think that patient participation in research is definitely something that can be boosted. And I think that on our end as researchers, there's a lot that we can do to improve participation. And one of those things is, when a patient participates in our study and the study has closed out, do they really understand? Do they know what their time and their effort contributed to? Do we do we mail them a small, a brief report saying, thank you for your time. This is what we found in our study. Thank you so much. Do we do that? Because if we do that, all of a sudden their investment, their buy-in, their involvement, their interest in research is increased because now they're directly tied to it. So I think that there's a lot that we can do as researchers to improve patient participation. And I think it's an excellent way to just improve the communication or the breakdown in communication right now.
Thanks, Shervonne. And speaking of patient engagement, but transitioning a little bit, um, in your own words, what is the A.S.P.E.C.T program? Who participates, and what is the value of participating as a clinician?
I would say that, it's synergy is the word that's coming to mind when I think of the A.S.P.E.C.T program. So this is a very unique program because I mentioned earlier we don't always have that crosstalk like we should. You can have clinicians on that side and then researchers on that side, patients over here, and everyone is not as close and as tightly coupled as they need to be. But with the A.S.P.E.C.T program, that's exactly what we had. So we had just a multidisciplinary array of persons with so much expertise. We had policymakers, we had researchers, clinicians, we had patients, we had um, health allies, we had advocates, we had all of these people, we had educators, all of these people coming together, bringing their own wealth of experience, their unique backgrounds, and all applying that collective experience and expertise to one thing. And how could you not have success when you have a setup like that? And that one thing was just improving engagement in eye care and in healthcare. And this program, I thought that it was tremendous. I learned quite a lot, and it's one thing to learn because you read it or you saw it, but it's another thing to learn through the human experience, through the lens of other people's experiences, and that is one of the most unique things about the A.S.P.E.C.T program. So in addition to all of that collective and diverse wealth of expertise and experience, you have all of that expertise being communicated through personal experience, through expertise. So you had clinicians and patients who were sometimes on different sides uh, of the scale, but then you had other times where they were on the same side when they were both advocating for, we need more focus on this area. We need more focus to be applied to patients' emotional wellness and the emotional health. And I think that the A.S.P.E.C.T program really created a rich and nuanced learning environment that really allowed us to see what we're doing great and what we're not doing so well. And so having patients, providers, and everyone share their input, share their experiences, share what they think the priorities are, all of that crosstalk really empowered all of us as participants to be more innovative, as well as being more circumspect in our approach to care. One of the most moving experiences for me, Julie, I think you've heard me say this, was just, one of the presenters spoke about disability and how we approach disability. And this was something that stayed with me. I still think about it because, I generally overcompensate when I work with persons who have disabilities. And in my mind, this was just me being empathetic. But through the discussions, and the presentations and the exchanges and the discourse between A.S.P.E.C.T participants, I was really able to realize that there were shortcomings in my approach. I was seeing the disability, but not the ability, and that really has helped me to take a step back and reimagine, reinvent my approach to how I deal with persons with disability. And that's just, that's something that you can't learn from reading. I know what disability is. I know what empathy is. I know what those words mean. But it wasn't until I was in an open, honest, highly nuanced, and and rich environment where persons were being very honest, being very open, and being very forthcoming about their experiences and some of the gaps and shortfalls that they thought existed in our healthcare system. It wasn't until we had some of those exchanges that I was able to take a step back and really realize where my own shortcoming lay. And so there's not many places where you have such an environment that is as conducive to synergy and growth as the Aspect program. It would be great if outside of Aspect, everyone was, communicating so freely in such a way. But this was something that so far I've only been able to experience within the program. And I think that it's truly an amazing program, and I hope that it definitely continues to be conducted, because I know that there are other people who stand to learn, both patients and clinicians and researchers as myself. But there are many other persons who stand to learn so much just by listening and by sharing.
Wow. Thank you, Shervonne. That was an incredible overview.
Thank
And
you.
I too have remembered the presentation on the models of disability, and that too has stuck with me. Um,
Definitely.
so we have come to the last question. Which is just before we close, are there any final thoughts, comments, or a story that you would like to share?
Um, so just, I mean, I have a story, but it's not necessarily related to Aspect. Well, it's kind of tangentially related to Aspect and the value, the value of Aspect. One of the studies that I was involved in here was focused on looking at differences between perspectives of patients and providers. So where do they agree? Where do they disagree? And if we can find out the areas where they disagree, how can we bring them together? And one of the things that I learned from that research, which was reinforced in the Aspect program, and it was very good to see it reinforced there, was the need for closer attention to be paid to patients' emotional wellness, their psychological wellness. And that came up in that study as a big thing, and patients felt like they needed more support. And then, once I uh, started the Aspect program, that point was made not only by patients but by providers as well, who in some cases shared their own experiences where they felt that as patients themselves, even though they were providers, they were patients in another institution, perhaps, where they saw the need and they recognized the need for greater attention to be paid to emotional wellness and psychological wellness. And that for me is one of the benefits of that program. I had to have an entire study to discover this. And here it was, just sitting there to be discovered in the Aspect program. And I can't even imagine the number of other gaps, problems, issues that, you know, could could be easily identified if persons were in an environment like Aspect. There would be so many more priority areas that we would be more attuned to if we had the opportunity to always be part of a multidisciplinary group. But instead of that, I had to have an entire study to find that out. And I just thought that that in itself spoke to the value of the program, that there are things that can be, there are very important and very significant things that can be developed just by listening to each other, versus, having an entire research study. And I thought that the two really go hand in hand. An opportunity, research provides the opportunity to learn from other individuals. And the Aspect program also provided an opportunity to learn from other individuals. And you also get that rich, in depth experiential knowledge that, unfortunately for me, I was able to get that through aspects, but I was not able to get that same quality of data and that same quality of experiences as I did through aspect. And so, in conclusion, I just want to say that this program is really a gem, and its only limitation so far is that it's not more widely available. But I know that Julie and Prevent Blindness are working to remedy that. And it was an exceptional program for me to be a part of. And I will carry the lessons, not just the disability one, but some of them I learned considerably. A considerable number of things, and I will carry those with me as I continue to progress as a researcher and as a human being.